Hey, this is Greg Downing with Texas Medicare and Health Insurance Advisors here in beautiful Austin, Texas. This video is real quick about the short-term major medical plans from United Healthcare. All right, so typically what's going to happen is I'm going to send you an email with quotes, and all you got to do is it's going to be from John Gregory Downing. Here's your quote, and just click on that. And then it's going to take you to this, and just click right here. It says to look at the plans. All right, and so that shoots us over to the site, and there's going to be two plans that you're going to be able to view. So what we're going to do is just take a look at the first plan here, which is a short-term medical plus Elite A plan. All right, so if we look at this plan, basically it's a $2,500 deductible, then everything's covered at 100%. As you see the price on this, I think this is for like a 44-year-old. You can, whenever there's an arrow, you can toggle, and it gives you options. For instance, if that's a little steep, you want to go to a $5,000 deductible, you can see how that changes. But all these plans that I'm going to send out are going to start with a $2,500 deductible. Once you hit the deductible, your coinsurance, everything's covered at 100%. This plan lasts for 360 days. This would be your start date. Now let me show you a little something here. If you'll look at the method payment, monthly is $327. If you want to pay one single payment, and you can do that, that will roughly save you 20% on the premium. So if you can do that, there's no other place in the world that you can have a guaranteed 20% return on your income. So if you can do that, you can save 20%. But these will all come to you as monthly. All right, so let's talk a little bit more about the plan. So this plan, you can always click on here. This has much more detail on the plan, but basically this has a $2 million coverage is your annual maximum. It's actually underwritten by Golden Rule, which is owned by United Healthcare, but you're using the Choice PPO network, which is a national network which covers more doctors and hospitals than I think any other company in the country. Now, on this plan, you're responsible for 100% of everything until you hit your deductible. But if you go see a doctor and you need an office visit, you're going to get a big discount, probably 40-50% on what they normally charge. So it does help. Now, this does have prescription benefits up to $3,000, but again, you got to hit your deductible first. And then there's some copays when you go. And one of the things they don't have listed on here, but if you just go to an urgent care clinic, and that's on the detailed PDF, it's just a $75 copay. So if you cut your finger, if you need to go see a doctor because you're really, really sick, you can go to an urgent care clinic, and as long as it's in the network, it's only a $75 copay. All right, but once you hit your deductible, and hopefully that doesn't happen, everything's covered at 100% up to $2 million. Now, with all these plans, it's a $20 one-time application fee. And you'll notice right here, if you're in the mood and you're accident prone, you can get a accident coverage to cover your deductible. So in essence, you break your leg, if you purchase this, it goes addition to that. It will take care of your deductible, so you really don't have any out-of-pocket costs. So that's something you can add on as well. All right, so, and then, there's your estimated monthly costs. Now there is, on all these plans, you have to join an association, and that's like $4 a month. It's not optional. It actually has really good benefits, but no one ever takes the time to review them and use them. But I highly recommend you look more into that because they are good benefits. All right, so this is another plan with just a little bit less expensive, but you have more exposure. I'm just trying to give options where you can at least afford some type of coverage because I don't want anything to happen to you. Again, this one's set at a $2,500 deductible. Once you hit that, you pay 30%, and the insurance company pays 70%. There is an out-of-pocket maximum of $5,000. So what you have to do is you have to add these two together. So your total out-of-pocket maximum, if something horrible happened, would be $7,500. So if you don't like that, these plans are better. You can, again, it has $1,000 deductible option. You could go up to $5,000. But to me, this is the best plan. But if you can't afford that and you want to have something, you can go this route. Okay, but either one of those. The same thing over here. The only difference is when it comes to prescription drugs, you're going to get a discount card to help you save on that, and everything else is the same application fee. All right, so let's say we go over here and we want to get this plan. All you got to do is click on Add it to Cart. This is not rocket science here, and they're going to give you the option to add some additional benefits. One of the things that I would recommend you look strongly at, their dental plans are good, all these plans are good. You could get critical illness plan, but the very last thing, this is the Healthiest You by Teladoc. It's $20 a month. Now it's per application. So if it's just yourself, it's $20. If it's a family, it's still $20. And what that allows you to do is call and talk to a doctor 24 hours a day, 7 days a week, and you can get them to write a prescription for you. So, and that costs nothing to use that service. It's just, you can add that on to your plan, and so and it has some other benefits. I'm not going to go into all that. You can click on all these things here to get more information. No, I really don't want you to pop up. All right, so let's say we're going to add that to it. So that's $20, and we are ready to apply. And I'm not going to go through all this. I'm just showing you how this works. So this has your information on here, your name, male, female. If you need to change it, you can change your sex right here. That's not often you can do that easy. But go through, then you're going to have to put in your height, your weight, and that would be for everybody, Social Security number. And then you're also going to have to answer medical questions, your billing address, and you can use a credit card for this. And you just complete it like you would any other application. So there's health questions, summary payment. You can use a credit card again or a checking account, print review, and submit it in. It's just that simple, and I will be notified and keep track of all this information. And there is my information, John Gregory Downing. That's the office phone number that you can reach me. All right, well, that's a quick summary on the short-term major medical plans, which I think are going to be a great option for many people who cannot afford the official Obamacare plans. All right, have a blessed day and look forward to being of service to you.